So I want to step back a minute and talk about the prison system as a whole. Illinois is, by many measures, among the worst in the country. Our prisons are extraordinarily old. Our maximum security prisons, the newest one is Stateville, which was finished in the 1920s. Menard and Pontiac are even older. In terms of medical care, we are among the most, the worst in the country. We do not spend nearly enough money on medical care. For a while, we were down to number 49 of the 50 states and how much money per prisoner we spend on medical care. We're now up somewhere around 40. In terms of the number of medical care providers we still have among the very lowest, like I think number 48, ratios of medical staff to prisoners. So what Marilyn was saying in terms of the impossibility of getting help at Logan is true in every prison in the state of Illinois. This is not a new problem. This has been decades in the making. For decades, we have over-incarcerated and underfunded our prison system so that the buildings are falling apart and there's not enough staff. But the other way to look at that is we simply have too many prisoners. And I think that's the better way to look at it. We have, as several people have said, instituted the slow motion death penalty. Illinois, in theory, has eliminated the death penalty, but we provide such bad medical care and keep people inside so long that, in fact, as Joe started us off saying, thousands have died unnecessarily. We filed a lawsuit about the medical care in the state of Illinois almost a decade ago. A year ago, it settled. The medical care was so bad that they thought it would take them 10 years to bring it into compliance with the minimum standards of the Constitution. Well, COVID didn't give us 10 years. It gave us less than a year. And we now have a true crisis in the prison system. The best evidence of this, the fact that they had to bring in the National Guard to provide medical care because the staff simply was unable to do it. They brought in the National Guard to Stateville. They brought in the National Guard to Sheridan. They brought in the National Guard to Hill Correctional Center. In each of those facilities, they had to set up tents because there wasn't enough bed space for people, the number of people that were sick. We now have COVID-19 in 20 of the 40 institutions that we have in this state. A total of 223 prisoners have been confirmed diagnosed, but the number is almost certainly higher because outside of Stateville, we haven't tested but 200 to 300 prisoners in the entire state. So we really don't have any idea how many people have been infected. There's that TV advertisement for Vegas. What happens in Vegas stays in Vegas. Well, I think it's important that we all know what happens in prison doesn't stay in prison. In Stateville, we saw this very dramatically. We saw that when the first people got tested immediately, 7 people had to be taken out to the emergency room in a nearby hospital. All of them were put on ventilators. It overwhelmed the emergency room. There was 0 spaces left for anybody from the community because every single person was being treated from Stateville. And Stateville, in a sense, is the best place for this to happen. Joliet's a big city. It's near Chicago. It has lots of medical resources. Think about Menard Correctional Center down on the Mississippi River, located in Randolph County. It's a prison that holds 3,000 people, almost twice as big as Stateville. There are a total of 2 ICU beds in the entire county. Should COVID-19 hit Menard Correctional Center, the healthcare system in the entire southern tier of the state of Illinois would collapse. So if you think that this is just a prison problem, you are wrong. This is a public health problem which we all have to look at. And that's the way we have to look at mass incarceration. Mass incarceration is not just affected prisoners, it's affected every community in the state. We are now locking up so many people that we've destroyed the ties in the community that are what actually keep people safe. Strong communities with strong family ties, strong social ties, strong community institutions where people can relate to each other. Representative was talking earlier about how they went out on the street in order to rebuild those ties in the last couple of nights. That's a project that should have been going on for the last 20 years. How much safer would those streets have been had we invested in schools, parks, after-school programs, instead of ripping people out of those communities and sending them to prison? A huge proportion of young black men and young brown men in the city from particular blocks are in prison. Other countries don't do this. It's not the only way to run a system. Norway, for example, which everybody's heard about, but you have to understand what's fundamentally different about Norway is that they don't believe that coercion is the best way to enforce social norms. They believe that strong community ties are what keeps us all safe. And therefore, when people break the rules, what happens is they say, well, the community must have broken down somehow. Well, how did these people become disconnected? So prisons there are not a way to rip people out of the community. They're meant to reconnect people to communities. So you may have a prison with only 300 beds, and that would be a big prison in Norway. Not 3,000 like Menard, but 300. They wouldn't be located 600 miles away. They'd be located next door. People wouldn't be locked in behind bars. They live in essentially dorm rooms communally so that they have to take care of each other. They cook for themselves. They clean for themselves. They're not locked in cages all day long. And they go home on the weekends. And they have jobs, not jobs sweeping the floor outside of their cell, jobs in the community. And they have very short sentences. A murderer typically gets 5 years at Norway. And those are long sentences. Why? Because the whole point of prison is to get you reconnected to the community. And it does not reconnect anybody to send them 600 miles away and lock them up for 20 years and then let them go and say, okay, you're on your own, figure out how to connect to the community. We need to rebuild our community. We need to take the money that we are currently spending on punitive measures and invest it in community ties to keep us all safer. We have a prison system right now which is 7 times what it was in the 1970s. We are not safer. All we have done is destroyed communities. We have not made each other safer. Thank you.